Hey guys, Patrick Ward here for Optimum Sports Performance, and today I'm going to show you a few techniques to address the Splenii musculature. It's actually two muscles, Splenii capitis and Splenii cervicis. The Splenii capitis has its attachments at the nuchal ligament as well as the spinous process of C4 to about T3, and it goes up and attaches onto the mastoid process. Splenii cervicis goes from about spinous process of T3 to T6 and goes up to the posterior tubercles of the transverse process of C1, 2, and 3. We can see this musculature right here. You can see that. Okay. One of the reasons to address this musculature, besides the fact that the trigger points refer up into the head, behind the eyes, as well as in the back of the upper trap region, one of the other reasons to address this musculature, though, and the most important reason probably, is the way that it functions. And it's one of the muscles that extend our head and also perform ipsilateral rotation and lateral flexion. So flexion to the same side and rotation to the same side. These movements have profound effect on the way that our head functions. So if we're looking at cervical ranges of motion, people who are limited in flexion, this would be a good these exercises or these techniques would be good for addressing that, as well as the full multi-segmental flexion pattern, so the toe touch. If you can get the chin and the head and the cervical spine to flex better, you can help and affect the entire chain all the way down and help them with their toe touch. So we're going to go in the other room and I'm going to show you 3 different techniques to address these muscles. Okay, for treatment number 1, we have our client supine. And what we're going to do is just kind of palpate around and get a feel for where the upper trap is. And during this technique, we want to make sure that we stay in front of the upper trap, so we don't want to go in around it. We're going to take the client's head, we're going to get our thumb right in front of the upper trap, near the most medial portion that we can get. So I'm kind of almost in towards the spinous process. I can feel his the spinous process, the C7 spinous process around that area with my first finger here. And all I'm going to do is compress down and in, and as I gently rotate his head passively, I'm going to push in, and as I rotate, the upper trap is going to kind of form a pocket. Now, depending on your client, the girth of their neck or the bulk or the musculature, this may or may not be an appropriate technique. It may be difficult to get in there. What you want to do, what you want to make sure, and what might not come out on the video as well, is when you get your thumb into the pocket, as you rotate his head, you also want that thumb, as it's pushing down, that hand to rotate as well. And that kind of helps you get a little more into the lamina groove and a little more near the spinous processes. So once again, I'm just going to come right in the front of his upper trap, as medial as I can get. And then I'm going to gently rotate, and I'm going to push in. I'm going to get right in, and I'm just pushing straight down into that tissue. For technique number 2, the idea is exactly the same as the first technique, except that the client is now lying on their side. For those with larger necks and more musculature, sometimes this can be a little bit easier because things tend to fall out of the way with gravity. Additionally, it might help ergonomically for your thumb to have the client like this rather than on their lying supine. It's a little tougher on the hands and the thumb in that position. This position allows you to get your hand lower a little bit and get it more in line. The same idea though, I'm just going to use my right hand here underneath Keith's head, and I'm going to find that same position right in front of the trap. So here's his upper trap. I'm going to come in right in there, and I'm just going to gently rotate and compress in with my left thumb, and we'll just hold pressure, and if he gets a referral, we'll hold until the referral goes away. If the tissue feels particularly tight or bound, or whatever word you want to use to describe it, wait until you feel something that reflects a change, a positive effect. And that's technique number 2. Okay, for the final technique, for technique number 3, this one is going to address a lot more muscles. Obviously, all of these, you're not just addressing one thing. As you compress in, you're getting a lot of other things as well. This one is going to be great for, I mean, while we're talking about Splenii, but we're addressing kind of everything in that cervical thoracic junction here, the fascia here. So what we're going to do is, we can feel the spinous processes. All I'm going to do is come right in next to them, right on into that lamina groove. And this is going to be kind of like a basic pin and stretch technique or myofascial release technique, whatever you want to call it. We're going to have the client extend their head back, so that's going to place the tissue into a shortened position. I'm going to take my contact right in. Just for FYI, the C7 vertebrae is usually the most prominent, so if he flexes his head forward, we can find that, and then we can base our treatment or our palpation from there. But I've got him in the head extended position. I'm going to take my contact in and just gently down, and then we're going to have Keats go ahead and actively take his chin to his chest, so active flexion. And all I do is I hold my place, and you don't have to push real hard, you don't have to be real aggressive. I'm just taking my contact onto the tissue. Additionally with this, we can have Keats go ahead and flex and take his chin to the opposite shoulder, and that will further put a stretch onto the tissue. And finally, I can also address this tissue in the lamina groove by gliding along with Keats's movement. So Keats is in extension, and as he slowly goes into flexion now, I'm actually going to use my thumb and work down through the tissue. Good, come on back, and again. And I'm just going to gently glide with my thumb down the lamina groove, and we'll do one more time, this time to the opposite shoulder with flexion. Those are 3 techniques that you can try for Splenii cervicis, as well as all this fascia up here in the cervical thoracic area. Hope you found those helpful.